We will continue to see high rates of influenza and RSV for the next few weeks. I expect if it follows the pattern that we've seen before, that we may have a peak in the next week or so.
An update from BC's top doctor Wednesday on the respiratory illness season, 3 months into the province's vaccination campaign. Instead of a surge in COVID-19, BC is seeing a spike in RSV and influenza cases. Dr. Bonnie Henry saying in the last 2 weeks, there's been an increase in outbreaks of influenza in long-term care homes and an uptick in RSV cases in children, and hospitals have reached record highs.
Overall, what we're seeing is that people in hospital, over 10,000 people in hospital this week, and respiratory illnesses are absolutely driving some of this pressures, particularly in young people on our emergency departments.
As of the last update from the BC CDC to January 4th, there were 219 patients in hospital with COVID-19, 26 of them in critical care. And as for vaccination uptake,
as of January 9th at midnight, BC had administered, for example, 1,519,606 doses of flu vaccines and 1,390,508 COVID-19 vaccines.
The health minister making it very clear Wednesday that while BC has the highest vaccination rates in Canada, we can do better, saying it's crucial that people continue to get immunized.
Dr. Henry says what we're seeing is similar to patterns we saw pre-pandemic and that the increase in cases is expected after holiday gatherings, but that we're not out of the woods just yet. Henry says great concern remains for children, with 3 deaths in kids under 10 reported late last year.
None of the children that were involved had received influenza vaccine this year, so that is sad for us because we know that it can make a difference. Whether it would have made a difference in these young children, it's hard to know.
Dr. Henry and Minister Dix with a take-home message. It's not too late to be vaccinated if you're not already. In Vancouver, Kate Walker, City News.